Hi everyone, welcome to day 3. Are you still energized?
Still energized.
Still
Yes.
on. A bit of change of scenery today, as you can see. We've been kindly invited by Catrix for this network event tonight. But still, let's have a little wrap up from today's takeaway.
Take away, Rado. Go ahead.
Want me to start? Yeah, okay. So for me, again, we've been moving on really in depth, but now we're really moving towards the end in the process, really, of the medical device, and really touched on health technology assessment. And really, there was one session that was really talking about value, and one key element there was, well, you don't just consider, efficacy, safety, but you really also need to consider the integration of the system. And not just technology, technically with the health IT infrastructure, but how you integrate it in the clinical workflow as well. And I think that's something that is very important to really take into consideration with AI, since AI is really redefining how we work. So that bit here is really quite central in the end process of how you get adoption. Yes, there is the trust level, but there is that trust as well that the system you build doesn't make you change completely how
Of course.
it works.
You don't treat it isolated.
Yeah.
Yeah.
Yes.
Yes.
Yeah. For you?
Well, for me, one of the core principles that I always read in these guidelines from international organizations is on transparency. So this morning I was in a sort of like a workshop, a circle solution, with people from the industry, and they were just basically sharing ideas and practices, how they fulfill the how they make their product transparent when it comes to regulations. And there's one thing that they pointed out that, one, that depends really on how you define transparency, because transparency can be seen in different perspectives, as a regulator, as an auditor, as a clinician, as also as someone from the industry. What may be transparent for me may not be enough transparent for you. So they were saying that it's very important to define transparency in the very beginning, to avoid confusion, to avoid inconsistency, which I agree. That I think this is something that we can also learn and apply in our work at HealthAI when we work with policymakers and regulators. It's very important to emphasize the importance of defining the scope, defining the limit. When implementing these principles on ethical and responsible AI.
Yeah. So what you mean is, when we say transparency in AI, is that you don't need to disclose everything to everybody.
Exactly. No, because this is one argument this morning. Like, hey, should I expose all our codes or formulas just to be transparent? We also need to protect our interests. But yes, that's a good point. That no, you don't need to disclose everything. So setting the scope, the limit, is very important. So that's something I was like, this is a good point. Something that I will bring again back to Geneva.
And on that note, we say good night and see you tomorrow.
Ciao from Brussels.